It's another day with the physicians where your health is our business.
Growth spurt will end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know?
You're welcome back to the Training Ultra on your regular program.
So parenting is a tedious job, and I give it to all parents out there, even my senior ones and myself that is a young parent.
Right.
But the most important thing is, once you are aware, no matter even if you are just suspicious, try your possible best to seek help.
Cancers that are known collectively as head and neck cancers usually begin in the squamous cells that line the mucous surfaces of the head and neck. For example, those inside the mouth, throat, and vox box. These cancers are referred to as squamous cell carcinomas of the head and neck. Head and neck cancers can also begin in the salivary glands, sinuses, muscles, or nerves in the head and neck. But these types of cancer are much less common than squamous cell carcinomas. On today's episode, you will get more enlightenment from our experts. Stay tuned. It's another day with the physicians where your health is our business. Today we'll be discussing head and neck cancers, the presentations, the signs and symptoms, the risk factors, the causes, possible causes really, and of course the complications, then the management. My name is Dr. Martina Agbere, your usual anchor on this program. And as usual, I'm not alone. I have with me my co-host.
I remain Dr. Memuna Yusuf Kadri, and it's always a pleasure to be on set because on your physicians, your health is our business.
So we'll be talking about head and neck cancers. And from the introduction, I'm sure you heard where I talked about it being in the squamous cell from the line of the mouth and even from the sinuses. Have you had any patients?
For me, I'm just like, with cancer, anything can happen. Cancer is just multi-organ. Anywhere, hair can be cancerous, bone can be cancerous, skin can be anything. So head and neck, way back as a younger medical officer.
Mine was actually my cousin.
And as a child, it was a not older person, somebody that and it wasn't so. It was for them. It was for us. We use it as a teaching, learning platform because we eventually lost the patient, but it was really hard on the parents of that child.
Mine was just a young guy. Actually, it was obviously from the sinuses that were involved, and it took a while for them to be able to detect it. Unfortunately, from the history, was when we took him to the Lagos University Teaching Hospital. From the history, that they were able to know that apparently he tried to learn a trade, camera, and he wouldn't use it. Cover.
So is it like an occupational hazard?
It was an occupational hazard that actually caused his own. It was so painful. We would just watch the guy go down, gradually going down, even with chemotherapy, everything he did, and the eye actually popped. The eye popped everywhere. Was really painful. Was it painful? I was a very young guy. Well, we have an expert that is coming to tell us more on this topic. Well, we'll be back after the short break. Stay tuned. Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. Today we'll be talking about head and neck cancers, the presentations, signs and symptoms, and of course complications. With me in the studio, we have a consultant, radiation and clinical oncologist from the Cancer Center of the Lagos University Teaching Hospital. He is Dr. Uwagba Godwin. Welcome to The Physicians.
Thank you very
You're
much.
welcome, sir.
Okay, so we're going to be talking about the head and neck cancers. Do you want to just give us a general overview of cancers? What are cancers, and why are we specifically delving on head and neck?
Okay, thank you very much. I'm so happy that we're discussing about this topic, head and neck cancer, or we call it head and neck tumors. And because it's not a popular kind of topic that people want to talk about, and you get to hear people talk about breast cancer, prostate cancer, GIT cancers, because these things are popular, they are common. But when you talk about the head and neck cancer, within the last 10 years, we've gotten to seeing it to be on the increase. The incidence has been on the increase, and that is why we need to talk about it. So by way of introduction, just the way you've introduced it, which is very correct, head and neck cancer, if you're looking at anything that occurs within the head, around the head, the mouth, up to the neck. The reason is because all these areas, they share one thing. They share what we call the lymphatic channels of the body around our head. So when you have cancer, either in the mouth, can be in the tongue, in the salivary glands, as you've talked about, or around the nasal area, the sinuses, what we call, these are empty spaces within the skull, so that it can help you drain out what we call the catarrhs and all those things. So these are areas that cancer, head and neck cancer, can arise from. Also, we have cancer with what we call the nasopharynx. The nasopharynx is just like a space, just in front, is in front of the ear, so which is very common. So by and large, it's not a common type of cancer, as we've said. It's about like the 10th common cancer that we have, and the incidence in terms of percentage is between 5 to 8% globally. So you can see it's not like the breast cancer, cervical cancer, prostate cancer. Both. The thing is this: we have been seeing it on the increase.
Wow.
It's been on the increase.
Why?
Now, we have to come to the point where we'll now be talking about the risk factors, exposure.
Sure.
So we'll get to that one. But the main thing is that why we even need to talk about it. Because if you look at some GIT cancers that are within the abdomen, you won't even know unless you go for screening. But head and neck cancer, because you're looking at it's ready for female, that you look at yourself in the mirror, you will know that this thing is exactly, you will know the change. By the time we get to talk about the presentation, the symptoms and signs that people will have, these are things that we'll see. So unfortunately for us, our patients still come very late. And that's what exactly, because you're looking at your face every day in the mirror, you are seeing the changes, but they still get to come late. So that's why it's good for us to talk about it, so that we can, and the good thing about the head and neck cancer, if you get it early, you might achieve a cure.
So now we know cancers everywhere. People talk about causes unknown, but can we elaborate on known causes and the risk factors?
Okay, so like rightly you said, we don't know the cause of cancer. that is one question everybody asks. We don't really know.
Can we ever get the answer?
So it's right that we don't know the cause of cancer, and rightly what you said, we talked about what we said, the risk factors. What are the exposure we can have? Definitely we have what they call risk factors. Risk factors you can have alcohol intake. Yes, that has been.
It is here again.
Yes, it's alcohol
You should say
intake.
smoking.
In fact, that's number 2.
And then obesity.
No, that's number 3. So
because it's becoming
so alcohol intake has been one major
constant.
Yes, for head and neck cancer. Smoking. Now, when you now talk about the combination of the two, it increases by tenfold the incidence. When you are taking alcohol and you're
smoking.
smoking cigarettes, it increases the chances of you to get, for the patient to get head and neck cancer. We have also the exposure. One of our moderators said occupational hazard. Yes, there are occupational hazard when you're exposed to chemicals like wood dust. Those times that they work in the wood, asbestos. Those of them that also work in the paint industries get to see all the chemicals that they're exposed. Yes, they can have they have risk factors that can make them have head and neck cancers. We have some infection that can also, viral infection. We're in the eras of using virus, COVID, but COVID is not one of them. Not one of them. We have what they call the human papilloma virus type 16, HPV. Yes, we have the HPV for the cervical cancer, which is the 16 and 18. Also, we have for the type 16 is more implicated for the head and neck cancer.
Wow.
So then we have even there's a type of virus, Epstein-Barr virus, that has been implicated with nasopharyngeal cancer. So we have all this. Then we have it can be familial. It runs in the family. And just how it runs in the family, we might not really know the pathogenesis. We just know that, okay, some people in their family tend to have this, especially with the nasopharynx, they tend to have that runs in the family. There are some genetic disorder too. Well, we have the Lynch syndrome that we can have. They'll just come up with cancer of the head and neck. So these are the common risk factors.
Okay, so you mentioned
an exposure to radiation.
Good. Exposure to radiation.
Yes, ma'am.
You've talked about the risk factors. We need to keep a date with the physicians. Let us hear what they have to say about cancers of the head and neck. And when we come back, we delve straight to the causes, okay? Or the symptoms, how they present.
Yes.
We'll be back after this short break. Just stay tuned.
I think the one I know is neck and mouth. And the cancer of the neck started right from the throat that leads to the swelling up of the neck. And the one from the neck and from the throat also affects the voice sometimes, that when you start talking, people won't hear your voice will be cracking.
Cancers of the head and neck that I know the cancer of the throat, the one of the mouth, the pharyngeal cancer, and so on. Those are the ones I know.
I know that of cancer of the neck, which is usually on the throat part of the body. So that of the head, like there are some things they will say they have a tumor or whatever. I think it's still part of that cancer.
The causes are like alcohol, taking too much of tobacco, and for occasional exposure, occupational exposure to like where you work. For example, where they produce asbestos, for example. So the more the person sniffs it in, the person can have the cancer of the head and neck, maybe the nasopharyngeal cancer.
I think what is common, the common causes of that is cigarettes, no smoking, all these hard drugs, they spoil a lot of things in the body.
Everyone knows that one, very sure that when you smoke too much and drinking, that is exactly what leads to cancer.
It's better to do away with those things that causes it, like all this drinking of alcohol, excessive drinking of alcohol, smoking. You have to avoid all such. And apart from that, see a medical person, normal checking of one's health is very important. So that even if there is anything, you can tackle it on time.
Maybe seeing a doctor on how to reduce the intake of alcohol, help you to then stopping tobacco intake. Then maybe where you work, maybe putting on nose masks, protective gadgets that will stop you from inhaling those stuffs directly into your system.
The only thing can reduce this cancer issue is to stop smoking. Or if you can reduce, if you can't stop it, then you reduce your smoking and your drinking.
Welcome back. If you have just joined us, you are on to your regular program, The Physicians, where your health is our business. Today we've been talking about head and neck cancers, the presentations, the risk factors, and in the studio, Dr. Uwagba Godwin. He's a consultant, radiation and clinical oncologist from the Lagos University Teaching Hospital. He's actually schooled us on some of the risk factors and what cancers of the head and neck represent. Now I want to hear from him the signs. How does it present? You have talked about the risk factors. So how will an individual present and for people to know that this is what this person has, cancer?
Thank you very much. It's very, very important. But, well, like what we always say, cancer starts from a cell. And from a cell, it grows and multiplies. And before you know, they now start having symptoms. Because we're talking about something that occurs in the head and around the neck. So that's why we call it a head and the neck cancer. So sometimes what the patient will see is that they might see an abnormal swelling.
Okay.
An abnormal swelling that has been there, is chronic, that's been a long time. You've seen that the swelling has been increasing. You can also have, especially for some cancers where we have the nose type of cancer and the sinus type, you have them having nasal blockage. That means they will not be able to breathe very well. And sometimes when it gets to the extreme, they will start having bleeding from the nose, what we call the epistaxis. Also, they can have neck swelling where they will begin to see what we call the cervical nodes. They'll just have neck swelling, and these will begin to increase in size. There are also difficulty in breathing. You have your mouth, you see swellings around the mouth, swellings around your neck. So these are the common symptoms the patients or somebody that will notice that have.
How about bleeding?
Yes, the bleeding. I've talked about the epistaxis, bleeding from the nose.
Okay. So how do you manage these cases?
Okay, so management is basically in the, when we're looking at the management, I will just list them out, and it can be surgical first. Okay. The second one is that you now do radiotherapy, there's chemotherapy, there's immunotherapy, there's a targeted therapy called monoclonal antibody. Okay. But before you even start talking about the management in terms of treatment, you have to do the investigation to be able to know that, okay, this is a head and neck cancer. First, the patient you have to notice the tumor, and maybe you have to go and do, by the time you go back to your doctor, they will examine you physically, they'll see the swelling, either you see an ENT, what we call the ear, nose, throat surgeon, or a general surgeon, but most times it's the ear, nose, throat surgeons, where they'll do some tests. The tests that you might do might be a CT scan, an MRI, magnetic resonance imaging, and those are the images that will be able to do and see where those swellings are. Then the definitive diagnosis you will do to say, oh, this is the cancer, is when you now do the histology. And that's why when they're taking a biopsy, what we call the biopsy, they take a little sample from that mass and they'll send it to the lab, and it now comes out and say this is histology. Like what's in introduction when they talked about the squamous cell carcinoma, which is the commonest type of histological type that we have in the head and neck. So surgery, radiotherapy, chemotherapy, immunotherapy, targeted therapy, and monoclonal antibody.
Wow. Family support, where does that come in? Counseling, dietary changes?
It's everything. The family support, the dietary is from the beginning, because the issue is this. Once a patient comes and is diagnosed to say this is cancer, the supportive system starts from that moment, because the person feels alone, feels that maybe he's going to die, feels that maybe everything is over. But there's something I want to bring out here, which is a little bit different from the other type of cancer. It's almost the same thing like breast cancer. Head and neck cancer, when it is gotten early, you can manage it and achieve a cure. Okay. But like what I said, most times our patients come early.
Okay. So what I want to ask is this, before I let you go. Is it easily detected? When one goes for normal annual screening, are you able to now screen for, the way you screen for breast cancer, prostate cancer, do you still go and say, I want to screen for head and neck cancer?
Yes, it's possible to do that, because it's just that we will not say, okay, subject everybody to do CT scan, subject everybody to do MRI, because this investigation are expensive. But sometimes when you see that you are having a persistent chronic ailment that you feel, look, I have a swelling, I have a nasal blockage, I'm bleeding abnormally, your doctor will tell you to go and do the test. So it's something that you can know. It's just like, it's not something that is within. Yes, we know it's within, but it's something you can see, because it's evident. You can feel it. Especially because if you're not breathing very well, you go to the hospital. I'm not breathing very well. If you're seeing blood coming out, you go to the hospital. So it's something that can be detected early.
Okay. Finally, preventive measures.
Well, preventive measures is
based on the cost.
Try to do medical checkup
regularly.
Look at yourself. Don't just look at yourself to rub
I said to rub
I'm sorry for female food.
Look for any swelling, any abnormality, any changes.
And for those for occupational hazard, I think they should wear their protective devices.
Wear your protective.
Those the wear should wear their shield. I hardly see wear that wear shields and such things.
They have even the people, all these asbestos painters, all those people.
Even the companies, organizations should actually provide these things for the people.
Yeah.
Okay. So thank you very much, Dr. Uwagba. It's been nice having you on our program. You've actually told us a whole lot about head and neck cancers. It's not something that is actually common, but at least you have been able to put more light on it. Thank you so much. I'm sure when we call again, you'll hear us and you come to our program.
Thank you.
So our viewers out there, thank you so much for being part of today's episode. And we discussed head and neck cancers. It is not really common, but the truth is that when it is detected early, it can be nipped in the bud. The symptoms, the signs are actually there. You can see them. It is not hidden. Swelling that is not normal. You just notice a swelling. What are you waiting for? Visit your doctor. Try as much as possible to exercise regularly. And of course, tobacco, smoking, and alcohol, they are like twins. Try as much as possible to reduce them if you are on the one that takes them regularly. And if you are not, try as much as possible to even stop it. For your health is very important. Again, I say thank you for being part of our program today. My name is Dr. Martina Agbere. Stay blessed.
Thank you very much, sir. And to our viewers at home, you've heard it. Head and neck cancers are not as common as other cancers. But if detected on time, there's a possibility it can be cured. And that's the beauty about it. Please, smoking and drinking, you've heard this over and over on our show. Reduce it. If you can possibly stop doing those habits, because they are dangerous and they lead to so many other diseases that you do not want to also encounter. Please feel free to always follow us on our various social media platforms, Twitter, Instagram, Facebook, YouTube. All the previous episodes are right there. And if you want to be a part of the program, you are just a click away. Send us an email and you will be here. My name remains Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
In Nigeria of today, orthopedic surgeons remain the bedrock of the management of musculoskeletal conditions, including fractures and any other associated bone and skeleton injuries. However, I believe that there's still a role for the traditional bone setters, as long as they understand the need for a structure, for education, for formal training, and we should be able to inculcate them into the primary healthcare system to offer much needed service to our patients. For more information on these and similar other medical issues, keep watching The Physicians.